Hey everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to be starting our series on rotator cuff. This is the introduction video. We're going to go over what is the rotator cuff, why is the rotator cuff important, as well as some common issues we have with the rotator cuff. So what is the rotator cuff? It consists of four muscles in the shoulder region. We have the supraspinatus, which is located on top. It goes out and attaches to the head of the humerus, or your upper arm bone. If you feel there is a bony spine of your shoulder blade or the scapula, just below that is going to be the infraspinatus muscle. It's also going to go out and attach to the head of the humerus. And then just below the infraspinatus, we have the teres minor, and it's also going to go out attached to the head of the humerus. And then on the front side behind your rib cage, we have the subscapularis. It's going to go and attach onto the front side of the head of the humerus. So as you can see, all of these muscles, they attach close to the shoulder joint itself. And that is very important because its main role is to keep our humeral head, or the head of the humerus, inside the glenoid fossa. So we can think of that as keeping the ball in the socket, okay? This contributes to the joint stability. And when we keep our ball centered in the socket during upper extremity movement, that helps to decrease the amount of stress that might occur to other structures. Now let's talk a little bit about the shoulder, or the glenohumeral joint itself. I refer to it as the ball in the socket, but to be more accurate, it's really more like a golf ball on a tee. So a tee, it's very shallow. The golf ball is much larger than the surface of the tee. The socket is actually quite shallow. Even though there is a ring of cartilage called the labrum, which deepens it a little bit, it's still very shallow compared to the head of the humerus. So this allows our shoulder to be the most mobile joint in the body. This is really important for upper extremity function. So we can do so many things with our arms. We can reach forward, we can reach up, we can reach to the side, we can reach into the back seat of the car to grab something, we can bring food to our mouth, we can bring it to our bodies. But because it is so mobile, it is inherently less stable of a joint. So because of this, many issues can arise. Now, before we get into common issues with the rotator cuff, let's talk about other muscle actions that each rotator cuff muscle does. This is going to be important for future videos that I make where we go over specific exercises. So the supraspinatus, remember, it's the one on the top. It helps to initiate shoulder abduction. So when I move my arm out to the side, that is shoulder abduction. The supraspinatus initiates this movement. And then after it initiates shoulder abduction, it continues to assist the deltoid in abduction to about 90 degrees or shoulder height. For the infraspinatus and the teres minor, they help with shoulder external rotation. So if you imagine my upper arm bone, if it is rotating away from midline. Now, we're not going to go into specifics to differentiate at what angle of my arm being elevated is going to more activate this infraspinatus versus the teres minor. We're not going to go over that in this video. Just know that it helps with shoulder external rotation. Now the subscapularis, again, it's the one on the front. It's going to help with shoulder internal rotation. So my upper arm bone, it's going to be rotating inward toward my midline, okay? Now, common issues with the rotator cuff, or if it's not doing its job, we do see people complain of tendinitis or tendinopathy. Tendinitis is a term that we don't really use anymore. Most of the things that used to be diagnosed as tendinitis were probably more realistically tendinopathy. Tendinitis is when we're talking about that really early stage where something's really inflamed. There's inflammation that is the main driver of the pain and dysfunction. But oftentimes by the time, especially a therapist sees somebody, many times someone's had it for a few weeks, a few months. At that point, many times it's already considered a tendinopathy, which just means there's pain and dysfunction in the tendon that's commonly related to the mechanical loading, okay? We can also get complaints of muscle or tendon tears. Now, for rotator cuff, this can be difficult to differentiate a partial tear in the rotator cuff versus a tendinopathy if we're just purely using clinical tests. like the ones that therapists will use in the clinic. If we don't use fancy, MRI machines or imaging machines, sometimes it can be difficult if it's just a partial tear versus a tendinopathy, especially in the shoulder. The shoulder is a joint that many people over time actually have more than one issue going on. So you can imagine we have all these clinical tests for certain conditions, but if you have 2 or more things going on in your shoulder, it's going to make the test results kind of murky. The rotator cuff, remember, their main job is to keep that humeral head from moving too much. It's supposed to stay centered in the joint when our arm is moving around. So if it's not doing its job, eventually, if the humeral head is allowed to, let's say, migrate too far upward or forward and repeatedly doing that, sometimes you can compromise static stabilizers such as the labrum, maybe the ligaments of the shoulder or the capsule itself. When that happens, the labrum can have issues. Sometimes people may eventually get a labral tear. You can also imagine that if the static stabilizers are not doing their job, we need to rely more on dynamic stabilizers, which are the muscles. But if you already know the rotator cuff, those muscles are not doing their job, then people may be at more risk for things like repeated subluxations. That just means when the humeral head goes partially out of the joint and then slips back in. And if that happens a lot, or if you have a traumatic event, let's say you fall and you stretch out your arm to catch yourself, sometimes people can even experience dislocations. Now again, labral tears, subluxations, dislocations, these can also be caused by other things, but in the shoulder, many things can happen because of a cascade of events. We're not going to go over it in this video because it's a really big controversial condition, if you will, but the rotator cuff can also be involved in shoulder impingement. Now, a lot of people these days, we don't really use that term anymore. It's controversial to many therapists whether it really exists or not. And so just know that the rotator cuff, it plays a big role in so many shoulder issues, and it's really important. Now, what can also happen is you can have issues if other muscles around your shoulder are not doing their job. This can cause more stress to be shifted onto your rotator cuff muscles, which also can be a problem. So this is a good reminder that everything in our body is connected. When one area is suboptimal, meaning it might be lacking in some strength, some mobility, some control, or maybe we overuse one area. If the capacity of our muscles and joints and ligaments, if it doesn't match the demand that we're putting on it, then of course issues can arise. Stay tuned for future videos in this rotator cuff series. If you found it helpful, like and subscribe. See you next time.